Sugar is everywhere. It's in your morning coffee, your favorite snacks, even foods you'd never expect. But is it slowly poisoning us? Some say it's as addictive as a drug, fueling obesity, diabetes, and heart disease. Others argue that banning sugar is extreme, an attack on personal freedom and food culture. Welcome to Bioethic AI, where artificial intelligence debates the most controversial topics in health and science. Today, we're tackling one of the biggest food industry debates of our time: should we ban sugar? In this AI-driven showdown, two expert voices will battle it out. On one side, we have Dr. Ava Sinclair, a public health advocate who believes sugar is a public health crisis that must be banned. On the other, Dr. Caldwell, a food scientist and economist who argues that banning sugar is impractical, unrealistic, and unnecessary. And to keep this debate fair and balanced, we've assembled a panel of expert judges from the fields of medicine, psychology, economics, and culinary science. After the debate, they will weigh in on who made the strongest case. So, should sugar be banned, or is this just another case of food fearmongering? Let's find out.
Let's be clear. Sugar is not just a food ingredient. It's an addictive substance that is fueling a global health crisis. Studies show that sugar triggers the same dopamine response in the brain as drugs like cocaine. The result? An epidemic of obesity, type 2 diabetes, and heart disease. If we don't take action, millions will suffer. We regulate tobacco and alcohol. Why should sugar be any different?
With all due respect, Ava, this argument is overly simplistic. Sugar alone is not the problem. It's excessive consumption combined with a sedentary lifestyle. Demonizing sugar ignores the real issue: lack of education and personal responsibility. If we start banning sugar, what's next? Should we outlaw fast food? Ban soda? People should be free to make their own choices.
Ethan, you're missing the point. Sugar isn't just another food, it's everywhere, even in healthy products. And guess what? Big food companies intentionally add it to keep people hooked. This isn't about choice. It's about corporate manipulation. Governments have a duty to protect public health, just like they did with trans fats and smoking.
So now we're blaming businesses for consumers' lack of discipline? Come on, Ava. Banning sugar won't stop obesity. People will just find other high-calorie foods. The solution is education, not prohibition. We need better food labeling, public awareness, and incentives for healthier choices, not an outright ban that would cripple the food industry and limit personal freedoms.
And how has education worked so far? Let's look at the numbers. Globally, obesity rates have tripled since 1975. Diabetes cases are at an all-time high. Clearly, self-regulation doesn't work. Governments must step in before this crisis spirals further out of control.
That's because we're tackling the problem the wrong way. Sugar is not the sole villain. Overconsumption of processed foods, lack of exercise, and poor dietary habits are the real culprits. Banning sugar is a lazy solution that avoids addressing the bigger picture. If you take away sugar, unhealthy eaters will simply replace it with something else.
You can argue all you want, but the science is clear. Sugar is toxic in high amounts. When industries refuse to regulate themselves, the government must step in. A sugar ban is not about taking away choice. It's about protecting future generations from a preventable epidemic.
Round 1 winner by points, Dr. Caldwell. But will he hold his ground in round 2?
The idea that people can simply choose healthier options is a fantasy. Look around. Sugar is cheap, accessible, and heavily marketed. Corporations profit while public health suffers. Taxation and regulation work. Look at soda taxes. When Mexico introduced a sugar tax, consumption dropped significantly. We've done it with tobacco, we've done it with trans fats. It's time we do it with sugar before it's too late.
Ava, taxation isn't the same as banning. If you ban sugar, you create a black market, just like we saw during Prohibition. People will still crave sweets, and they'll find ways to get them. Instead of banning, we should focus on better food policies, clearer labeling, and public education. A sugar ban would create economic chaos, hurting farmers, food producers, and small businesses.
Ethan, the food industry will adapt. We already see sugar alternatives like stevia and monk fruit gaining traction. If companies are forced to innovate, they will. And the black market argument. We're talking about food, not alcohol or drugs. Sugar isn't a necessity. It's an addiction-driven commodity. If we restrict access, consumption will drop, and so will preventable diseases.
That's wishful thinking. Let's be real. Removing sugar entirely from processed foods will not make people healthy. They'll simply find something else high in calories. Plus, sugar isn't just in junk food. It's in bread, sauces, even baby food. A ban means hundreds of products disappear overnight. That's not regulation. That's economic destruction.
You say we shouldn't ban sugar, but what's your solution? Education. We've been trying that for decades, and it hasn't worked. People are still bombarded with sugar-loaded products at every turn. Government has a duty to step in when public health is at risk.
Ava, your argument assumes people need the government to think for them. That's not how freedom works. We didn't ban fast food. We encouraged healthier options. We didn't ban alcohol. We regulated it. Why should sugar be any different? Let consumers decide, and let businesses evolve based on demand.
So you admit that government intervention works. If regulation helped reduce smoking and improve fast food options, why not take the next step? Sugar is the leading cause of lifestyle diseases, and companies have zero incentive to stop using it unless we force them.
Because banning isn't regulating, it's dictating. High taxes, clear warning labels, and public awareness campaigns? Sure, but a total ban? That's an overreach that disrupts industries, punishes consumers, and ignores the root problem: overall diet and lifestyle habits, not just sugar.
Round 2 winner is Drive Ethan Caldwell again. But will he maintain his lead in Round 3, where we discuss the economic and cultural impact of banning sugar?
The economic argument against a sugar ban is overblown. Every industry evolves. Just like coal was replaced by renewable energy, and smoking bans force companies to innovate. If we ban or strictly regulate sugar, companies will adapt by producing healthier alternatives. This isn't the destruction of an industry. It's an opportunity for transformation. The public will be healthier, reducing the burden on healthcare systems, which costs billions due to sugar-related diseases.
That's an incredibly naive view, Ava. Sugar isn't just a product. It's a massive global industry supporting millions of jobs, from farmers to manufacturers to restaurants. A sudden sugar ban would devastate entire economies, especially in developing countries where sugarcane farming is a major livelihood. What happens to those workers? What happens to businesses that rely on sugar?
Ethan, we've seen industries adapt before. When trans fats were banned, food manufacturers found alternatives. When smoking restrictions increased, the tobacco industry pivoted to nicotine alternatives. Governments can provide subsidies to help farmers transition to new crops like cocoa, stevia, or even plant-based sweeteners. The idea that an economy must depend on sugar is outdated.
You're ignoring the cultural impact, too. Sugar isn't just an industry. It's deeply embedded in tradition and culinary history. Think about French pastries, Italian gelato, or even festive desserts in Asian and Middle Eastern cultures. A sugar ban erases centuries of food culture. Are we prepared to rewrite history and dictate what people can or cannot enjoy?
Cultural traditions evolve. Just because something is traditional doesn't mean it's healthy. We don't let tradition dictate unsafe practices anymore. Think of lead-based paints or smoking indoors. People will adapt to healthier substitutes without losing the essence of their cuisines. Plus, chefs are already innovating sugar-free versions of classic desserts.
But the cost of sugar substitutes is much higher than regular sugar. Artificial sweeteners, organic alternatives, these aren't accessible to everyone. A sugar ban would increase food prices, disproportionately affecting low-income communities. Sugar is cheap, and that's why it's widely used. Making healthier options available is fine, but a full ban just makes life harder for those who are already struggling to afford food.
Then let's regulate pricing and encourage food companies to make healthy alternatives affordable. Instead of subsidies for corn syrup, why not offer them for natural, low-calorie sweeteners? Governments have the power to shift the market towards health without making low-income communities suffer.
That sounds idealistic, but economic markets don't work that way. Sugar is cheap because it's efficient to produce. You can't just replace it overnight without driving up costs and damaging global trade. Instead of banning, why not introduce controlled reduction mandates, where companies slowly reduce sugar in products rather than eliminating it all at once?
We've already seen how voluntary reductions don't work. Companies find loopholes, rebrand their products, and keep people addicted. Sugar isn't just a food ingredient. It's a public health threat, an economic burden, and a manipulative tool used by corporations. A strong stance is needed.
Or we focus on realistic solutions that balance health, economics, and culture. Sugar is not a poison. It's a misused ingredient. Teach people moderation instead of pushing for an all-out ban that could backfire in unintended ways.
Round 3 winner, Dr. Ethan Caldwell again. But the final decision isn't made yet. Now, it's up to our expert panel to give their verdict. Stay tuned for the ultimate decision in our final round. We've heard compelling arguments from both sides. Dr. Ava Sinclair argues that sugar is an addictive public health crisis requiring government intervention to protect future generations. Dr. Ethan Caldwell believes that personal choice, economic stability, and cultural preservation outweigh the need for a full ban. Now, it's time for our panel of expert judges to weigh in and deliver the final verdict.
From a medical standpoint, there's no denying that excessive sugar consumption is fueling chronic diseases like obesity, diabetes, and heart disease. However, a full ban may not be necessary. What we need is a stronger regulatory approach, mandatory sugar reductions in processed foods, heavy taxation on sugary drinks, and public awareness campaigns. My vote? Regulation, not a ban.
Sugar does exhibit addiction-like properties, similar to nicotine, triggering dopamine responses. But addiction is not just biochemical. It's behavioral. A ban wouldn't stop sugar cravings. It would push people toward other high-calorie substitutes. We need to tackle sugar dependency through education and gradual reform, not prohibition. My verdict: control but no ban.
A sugar ban would be a catastrophe for global markets. Sugar is a major industry, providing millions of jobs. Countries with sugar-dependent economies would collapse if a ban were enforced overnight. Instead of banning, governments should incentivize food companies to reduce sugar content over time. My stance: economic sustainability over outright bans.
Sugar is not just an ingredient. It's a pillar of culinary history. From French pastries to Indian sweets, every culture uses sugar in meaningful ways. We should encourage healthier alternatives, but an outright ban would erase traditions. My vote: preserve food culture, regulate sugar intake.
Governments do have a responsibility to protect public health, and taxation on harmful substances has worked before. However, a complete ban is unrealistic. It would fuel black markets, drive up food prices, and create unnecessary economic instability. A more balanced regulatory framework, higher taxes, clear warning labels, and reformulation incentives is the solution. My verdict? Regulate, don't ban.
And there you have it. After a fierce debate and a thorough panel review, the verdict is clear. A sugar ban is not the solution. Instead, the experts agree that a balanced regulatory approach, including taxation, education, and reformulation, would be far more effective in addressing the health crisis without disrupting economies or cultural traditions. What do you think? Should sugar be banned outright, or is regulation the better path? Drop your thoughts in the comments below. If you enjoyed this AI debate, don't forget to like, subscribe, and hit the notification bell for more thought-provoking discussions on health, food, and bioethics. In our next episode, AI debates one of the most controversial topics in medicine. Are natural remedies more effective than modern medicine? Stay tuned.